I have with me today Sarah Hoit, who is co-founder and chair of SIP's Global Brain Health Initiative, co-founder and CEO of VitalityIP, co-founder and partner of Retail Health Initiative. And I understand she's had 35 to 40 years experience in building companies and particularly tech companies that are focused on improving health. Welcome to Sarah. Next, we have Pietro. Pietro is the growth officer at Sodexo. Did I say that right? Yeah, Sodexo. Global Healthcare and Seniors. And Michael Connor is co-founder and CTO of VitalityIP. Now, I'm just meeting them all for the first time today because I'm actually filling in for Rim Mayadi, who is president of the Euro-Mediterranean Economists Association, who unfortunately at the last minute couldn't be here today. But please please welcome our panelists. So our brains are, as we know, the most valuable asset, yet millions of people worldwide are not reaching their full potential due to nutritional gaps that directly affect cognitive performance and mental well-being. If we want to strengthen the brain economy, it will be important to better understand the connection between what we eat and how we think. And I just wanted to speak to the panel who purposefully are all standing up today because they want this to be a dynamic session. But we might dive straight in. Sarah, you lead a non-for-profit and for-profit organisations dedicated to brain health. That's a unique intersection. Can you briefly tell us about your work and what drives it?
Well, it's so nice to meet you. Is this microphone working? Okay, good. This is, first of all, such a fun room to be in. There are so many friends in this room. And Paul, thank you so much for your incredible organization of this day. I am so excited that the topic is investment and brain capital because my whole career as a social entrepreneur is trying to find that cross-section between how do we bring capital to solve problems, whether it's in the nonprofit or for-profit sector. So for me, this is a completely obvious conversation. And in my nonprofit world, I think we have such an amazing ability to convene and do research and bring people who don't normally talk together. So in our nonprofit, it focuses on youth engagement and getting innovation, collaboration, and investment in new ideas where we can take action. And it's in that context that I have met so many of the people that are working together in an action-oriented way. I met Michael through the collaboration work that I do at Harvard to try to bring food companies, technology companies, and others who have products that can impact people's lives. And he was the former head of AWS at AI. And we saw that we could profoundly affect with AI precision nutrition. Pietro and I have known each other for over a decade. As a tech CEO, I've had the pleasure of working with Sodexo, who truly has the ability to affect over 100 million people in 40 countries every day with what they serve. And so for me, this ability to sort of look at how can we in our nonprofit and for-profit worlds make a huge impact, it's obvious. But you asked the question sort of why. And I'd be remiss if I didn't say why, because we all have a personal story. So yes, I've been a CEO, and yes, I've been working in this space for over 30 years. But my children and I also just faced the unimaginable. And while I was serving many other families in the same situation as a tech CEO, trying to connect them during the pandemic, my husband was diagnosed with what they thought was Alzheimer's. My kids were 11 and 12 at the time, and we lost him a few years ago to what was Lewy body and frontal temporal dementia. How little we know about everything and how important it is, the work that we are doing. And yes, thank you so much. Never having a kid wake up again in this situation. So that's my why.
That's a tragic story, and sorry for your loss, but really an inspiration, all that you're doing in this space. Thank you. Pietro, Sodexo serves millions of meals daily around the world, which is also very inspiring. Can you tell us briefly about your work and why brain health is a focus for your organization?
Sure. First of all, let me start also to thank the organizers. This is an incredible event. So we should players like us and us first should take more part of these initiatives because, in fact, we believe at Sodexo we have a great opportunity to impact brain health through nutrition. So and why is that? And why is it we think is so important? I think first of all, Sodexo, probably brand not as known as some of the others that you've seen on the board, we are one of the leading food providers, food services providers in the world. So we serve about 100 million people in about 50 countries. We have 400,000 employees. So we really have a massive impact on the lives of millions of people every day, right? And not only that, we do that from the very beginning of their lives when they're born in the hospital, through school, in the workplace, in the senior living retirement community, in the hospitals, and even when they're having fun in stadiums, right? So we have, so we as an organization are very much mission driven, and with this ample reach comes a mission of impacting the communities we serve. So the first reason for Sodexo is really that we are a mission driven organization. The second reason is because we believe at Sodexo that our key differentiating factor is actually that we are strong in nutrition. So we are the largest world employer of nutritionists and registered dietitian, over 5,000. And so that's a powerhouse that we can orient to help people, to inform people on nutrition and impact people's nutrition every day. So that's the second very important point. And the third, which is obviously very relevant for a for-profit organization as we are, is we started capturing signals in the market that this was becoming important. So no surprise, where did it start? It started in senior living, which is actually the area that from a strategy and marketing standpoint, I follow more closely. Because obviously there is a very strong interest in delaying the onset or the progression of Alzheimer's or other neurodegenerative diseases. But it then started trickling down in other aspects, like currently is starting to become a need in university students, right? After the pandemic, it became clear as a need in workplaces because nutrition has an impact on ability to concentrate and so on and so forth. So obviously, as soon as we started picking up signals from the market, we said, okay, that's an opportunity. We can't quite quantify the ROI. So we had to take a leap of faith with our CFO, like connecting to the last panel, is not only the ministers of finance that have short-term ROI. Try with for-profit CFO, right, to see if they have short-term ROI. So we took a leap of faith and we started investing, and we'll speak about it in small priorities and small research that is now triggering a big effect.
That's really inspiring. Thank you, Pietro. Michael, from a technology lens, can you tell us about your work and how is data changing the way we understand brain health?
Sure, yeah. I'm so excited that everyone's talking about data. I'm a data scientist, and most people were not terribly interested in data until very recently. And so there's a lot of buzz about it. And I hear people say that data is the new oil. There's so much excitement. But at the same time, I feel like we've never had so much data, and a lot of these really sticky problems that we deal with, especially around brain health, aren't seeming to get any better. So I think that's going to change in the near future. So one of the things that we're seeing is the advent of wearables. How many people have a wearable, a Whoop or an Oura Ring, a glucose monitor? And so studies that were collecting data that took researchers a long time to analyze, all of a sudden this is getting down to a very personal level, where we can run a study that used to cost millions of dollars. We can now do that with wearables very, very quickly. We can see real-time insights into people's bodies and how they're responding to different interventions. But not only that, but people, individuals, like we can all see the consequences of our decisions. I actually had anxiety for a couple of years. And it was my doctor diagnosed it as anxiety. After 3 days with a glucose monitor, I saw that was high carbohydrate breakfast. Within 3 days, I cured my anxiety. And so we see people correlating highly processed meals at night and how that impacts sleep. We see people consuming artificial sweeteners and they're getting migraines. So over and over again, we're starting to connect data. And I think the opportunity of artificial intelligence is it's democratizing the insights. So we have all this data, but we really lack insights. And unless you're a data scientist like me, it was hard to figure out all this information, your Oura ring and your glucose monitor. So I think for the first time, we can now use artificial intelligence to make sense of the data and produce insights that are now actionable. So I think in the next 5 to 10 years, we'll see this data, but actually people being able to take advantage of it to not only focus their long-term brain health, but really feel better like today, tomorrow, and get a lot of clarity and feel better overall.
As a fellow data nerd, I'm very excited about what you're saying. Okay, so now we're going to move on to why nutritional self-awareness matters. Sarah, let's start with you. What do we know today about the impact of nutrition on brain health and cognition?
Well, I think one of the really exciting things about standing up here with Pietro and Michael in the last panel, both last panels talk about where are we taking action? What is actually happening? Where can we make a difference? How does this change our lives? So that's our entire story. I don't want to do anything where we're not actually making an impact. So we talk about nutrition and lifestyle. We know it has, we can all debate the numbers. 70, 80% of our outcome is what we eat and what we do. And knowing here in the US, the incredible obesity rates, all of the other factors that we know and inflammation that lead to dementia are things that we actually can control per the last conversation. So we did something really exciting together. Okay, wearing my nonprofit hat, I brought together a lot of the top scientists and youth leaders and major corporations and all the leading nonprofits, of course, George Freidenberg and Drew, and no party's complete without all of them. And we decided to come up with some really great new ideas. How could we use food to impact our outcomes? Well, of course, Sodexo is at the table. They always are. And the winning teams from these students, 130 students, 14 countries, were food as medicine concepts, okay? So Sodexo decides to put out a global white paper on nutrition in the brain. Do that through the nonprofit. Why do I have nonprofits and for-profits? We do that through the nonprofit because it's a safe place for us to all collaborate, talk, scientists, McCann Center for Brain Health, lots of good Boston people, Harvard, Mass General. So we came up with, we actually didn't set out to come up with a new neuroprotective diet. We looked at all of the top research and over 250 journals and papers and the credible research out there. And we actually, in all the top diets, all the ones we love, Mind and Medi and Dash, that we're also excited about, and building on the shoulders of those giants, we actually realized there was, there's missing stuff, and there's new stuff that we just learned, and we've just talked about it, new biomarkers, there's all kinds of new stuff. It's so exciting. So we actually put it all together, and where we thought there were gaps or opportunities for information that wasn't given, we actually created a new neuroprotective diet that we are super excited about. Okay, so what's going to happen now? Partner who feeds 100 million people a day in 40 countries. That's a good partner, and they really care, and they help co-create it. So we are working actively to now put that into place. Well, here's the excitement of Michael. Well, so many things are exciting about Michael, but this moment of AI, and it is not the boogeyman, right? We have never had the ability. How do I and my kids, we try every day to do the best things with what we know to change the trajectory. It wasn't just my husband, it was his brother and his older brother and his father. So we got a pattern here. We can now do precision nutrition. We can all look at a diet and say, oh, here's the Mind diet, this is super cool, or here's our new Vibrant Minds. How do we do it? How do we actually do it? How do I get the recipes? How do I honor the allergies and conditions in my family? How can I look personalization? What is locally available to me in France, in Africa, in Georgia, in Boston, different stores? Like we can see a diet. How do I do it? And I think what's so exciting about this moment is not that diet. We're very excited about it, but it's the ability for us to take the data and personalize. And what you're going to see, we're not only doing this with these guys at the forefront trying to bring precision nutrition. Now you go back to our favorite topic, seniors, and others who have multiple conditions and for whom it's really serious that we get it right. And the math problem is too hard for most people to figure out. You're trying to now serve 150 people in a community. How do you do it? Well, guess what? The AI is really good at it. It's really good at figuring out, this is Sally and this is her situation and here's what she needs. And so we might all have this diet we want to do, but we're all different. And until we can personalize. So for me, the huge excitement of all of this is the ability now with the company that we have designed, and Michael left Amazon in his big cushy job to jump off the cliff and do this so we could actually bring these data sets so people could eat in a neuroprotective way. So for me, the diet's about personalization.
That's super exciting. I think everyone in the room would agree that diets are a really crowded space. So having someone kind of sift through and make sense and personalize a diet, I think is really exciting. Thank you, Sarah. So Pietro, Sodexo is uniquely positioned to influence large-scale eating habits. How do you see your role in creating brain-healthy environments?
Sure. So I'll frame the answer around three, I would say, artificial contrast that we face every day. The first contrast is healthy food is not good. First, this is a fundamental bias that we hear all the time. In fact, the people that actually raise this point the most are the seniors. When you show up as a leader of an healthcare and senior living into a senior living community, they tell you, no, we are senior living. Actually, even we don't even like the term seniors, but healthcare really absolutely not, right? So there is a constant concept that whatever is healthy is not exciting, is not good food. And our job and our contribution is to prove that that's wrong. And to prove every day that healthy food at every stage of life, I would concur on a comment before, we need to start much earlier from the kids. At every stage of life, healthy food is actually delicious. And that's where nutritional sciences, but also the research on culinary can help greatly, right? The second contrast or artificial concept is, whatever is healthy for you and God forbid is good for the environment is actually very costly. Also wrong, right? So in fact, even before we started working on a neuroprotective diet, we started on a plant-forward menu. What does it mean? That we have a high percentage of our proteins that come from vegetables or plants or fruit, right? And where did we implement it? One of the best case studies that we have is the Health and Hospital Corporation here in New York City, the public hospital system. Do we think that the public hospital system in New York City is a high-spending community? No, it's not. So we had a proposition that was economically advantageous, but was also incredibly healthy and good for the environment. So again, through science and nutrition and through culinary expertise and for Sodexo, the power of a supply chain, you can make healthy food and brain-healthy food affordable. So that's also our second contrast that we face. Now, the third one, which is where comes the technology part as well, is having a diet that is healthy, brain healthy. Well, it's a great idea, but it's incredibly complicated. How do I bring it into everyday life, right? And that's a bias. So everybody's busy. It's not only in his or her individual life, but also somebody who's running a senior living community has a million problems. And last problem to have is let's implement a new diet. And that's where organizations like ours have a role to play, and also have a role to play in, even for ourselves, implementing it faster, adjusting faster to the environment, which requires a big leverage of technology. So these are, I would say, are the three ways in which we can help. Now, none of that can be done solo, right? So I go back to the point of the partnership. Honestly, I don't think eventually we would invest in a neuroprotective diet if Sarah didn't knock at the door, because she also brought and convinced stakeholders that brought credibility, and we didn't have time to invest the resources to go and look for them, right? So it is, and we wouldn't be able to do the next stage on the technology standpoint without partners. So I think that's where obviously it becomes critical that for a corporation, especially for profit corporation, to stay focused on its core, on its few capabilities that I mentioned before, while leveraging partners to bring other aspects to the table.
That's great, Sarah. You've been very successful in convincing Pietro about the need for nutritional self-awareness. But most people don't know what their brain needs. Can you explain the diet that you're recommending?
I can. I may even go off script a little bit here because I feel like this is such an intelligent room that you all know what's good for you already. You know, the fresh fruits and vegetables and the organics and all the things, the nuts and the berries. I think this is such an hopefully action-oriented panel of what can we do and where are we. I actually want to pass the ball. Everyone knows I love to talk, but I'm going to stop. Pass the ball to Michael because he can actually show you what we're talking about. If you take the AI, so this revolutionary convergence of nutrition, lifestyle, science, and AI, and its ability to actually take a person. So he's going to be brave enough to show you his family. How could I take the neuroprotective diet we're talking about and actually make it actionable so I could put in the particulars of my family, the ingredients I want, the store near me, either go shop it or have it delivered to my doorstep. Now that's actionable because my kids and I are trying desperately to walk the walk. So Michael, why don't you show what you've built?
Yeah, before I show it, I think one of the common themes that keeps coming up today is scale. And so there's so many people affected by cognitive decline that we have to have a scalable solution. And that means hitting people in 209 countries with hundreds of languages and cultures and different cuisines and traditions around food. Even every individual is on their own health path. They have their own physiology, genetics. And not only that, but like what's in season, their budgets, the cooking utensils they have, the equipment that they have. And so this is a very complex problem. Ideally, we could have about 2 billion nutritionists that are in every home around the world. But we think the AI kind of gives us some of that scale. So let me share this. This is essentially, I think I have to click play. Yeah. So the idea is that AI can now create a highly personalized coach that you can talk with every single day. And it can think through things like your genetic markers, what we know about you, your likes, dislikes, aversions. Everyone seems to have their things, gluten allergies, keto. And so the AI can then put together full meal plans for the week that honor a neuroprotective diet and kind of help you accomplish what you're trying to accomplish through diet and nutrition. But then, of course, if it's not giving you what you want, there's always the ability to have a discussion. And so here the user is asking for a grilled salmon recipe for Monday night. And just little by little, the AI gets it fairly close. But whenever there's things that just don't align with what they want, what their family might like, they can ask questions, recommend different changes. And of course, the AI learns over time what your family likes. So here she's asking for braised chicken. On this one, they're asking for pancake recipe for Monday, and it comes back with quinoa pancakes, which I think is a hard pill to swallow for a lot of people. So, so the user comes back and says, "Hey, we all have to." We all have to eat food that we like, and we can't be perfect, 100% of the time, right? So again, we've got to make this as easy as possible, right? So make it fit with your culture, make it fit with your lifestyle, but then also the ability to then take that and create a shopping list, so we can prioritize or avocado oils, olive oils, organic foods, and things like that, and we can make it easy for you to then, with a few clicks, get this on your door in an hour. So I think it's hard for people to change their food and their diet. We've all tried it. There's so much behind that, culture and families and what we're used to in cooking, like the recipes, the ingredients where that are in the store. And so the health coach can also help with your wearables, give you coaching on different things and how it affects your blood sugar. And then also even recommend supplements. So we've talked to a lot of retailers about this. This is where we're focused, of course, with Sodexo, who feeds 80 million people a day. So we can kind of roll all the new science on polyphenols and all the different benefits of these diets, when we can kind of do this at scale across 209 countries, across all of the Sodexo consumers, I think we have the opportunity to scale.
Super incredible and very strategic to show this just before lunch. I think a lot of people will be signing up. This is making me hungry. Thank you. Did you want to add anything? No, we're all good. Okay, so we're just at the rapid fire stage of the panel discussion. Let's look into the future and give us one sentence on what you think, what innovation or breakthrough do you think will most transform global nutritional self-awareness by 2030? Sarah?
Well, I think this idea of hyper-personalization, and rather than in this confluence of science and technology, and lifestyle changes to be able to really transform what we're talking about. I think that's so key, because often we can look at the stats and we can see what's out there, but how do we change it? How do we change our own lives? And actually, how do we create business models that people want to invest in? You know, if I were to get up tomorrow and say, what could I do most to change the world? It would be brain health. But I actually feel if I were to get up tomorrow and just try to make the most money possible, that is my driver, I would be doing the exact same thing. This is what consumers want. People are sick. We know everyone's walking into the store with a condition. So it's not just the large food service companies, and obviously they have been a true leader in this up to the very top, caring about brain health, and we've been working on it for quite a few years. But we now have major retailers all over the world who understand the shoppers are coming in for solutions, as Michael was just saying. So personalization and impact, and something consumers can actually do.
Wonderful. Pietro?
I will make a parallel again, and I think my parallel is with gluten-free. So I am, as my accent betrays, Italian. And if 10 years ago you asked, people were asking me, where can I, people with intolerance to gluten were going to Italy on vacation, I was saying, good luck. Because 10 years ago, it was really good luck. You couldn't find anything in the shops, no option at the restaurants. Today, you can find all of that. You can find delicious gluten-free food. You have a gluten-free option in every meal menu in every restaurant. And I even found a complete gluten-free bakery during my last trip. I was in a rural town, in a small rural town where I grew up. So I was shocked. So my wish for 2030 is a brain-healthy food option on every table.
Very good. Hard to beat that. Michael, go for it.
I think to kind of build on what Sarah was saying with personalization, I think life has gotten very complex. In the last 50 years in the United States, the average household has lost 35 hours of leisure time. And so we're all working hard, we're all busy, and we've got more choices than ever. When you go to the grocery, on average, a grocery store has about 20,000 items. And so it's just gotten really complex to try to figure out, you know, how to live a healthy life. And we know diet and nutrition impact so much of it. So I think it's been difficult, but I think with AI, what we're going to see is it's going to democratize intelligence and it's going to empower the individual again. And so instead of going and wading through 20,000 items at the grocery store, many of which are not good for you, I think you're going to tell the AI what your health goals are, what your family is like and what they don't like, what your goals are. And then the AI on your behalf can find the best recipes, find the cheapest ingredients. So it's balancing like food that tastes great, that's healthy, it's convenient for you, right? It fits within the time that you have to cook. And of course, it's cost effective. So I think it's going to be an exciting time.
Wonderful. And I love that it comes to you. It means you can avoid those aisles of suggestive selling on either side of the checkout.
Right.
Thank you. So we've got time for some questions from the audience now. Does anyone want to ask the panel some questions? Yes, just at the front here behind Pavel, first one, and then second one.
I was just curious, how do you evaluate whether it's working? Can you repeat
So,
the question?
I love that question because
He asked, how do you know if it's working? How do you evaluate if it's working?
one of the things that we are very excited to do, and this is brought up by almost all of the last panels, is I feel like we also have a corporate responsibility right now to move science forward. As science is being halted in some different areas and there's some challenges ahead of us, it is our responsibility. And so we fully intend to do pragmatic trials, to do health challenges, to look from the wearables to our outcomes, to medical outcomes. Just held a meeting at Harvard, and our little Boston back, I wish you guys had been there, we're now going to partner going forward, had all the major food companies and tech companies going to say, the topic was, how do we move science forward? That was the topic. Roundtables, you serve hundreds of millions of people and have millions of employees. How do we now create trials and move the science forward? And that includes the payers. So we're working with some of the fintech people. I am most interested in what's happening in the food deserts. I'm interested in SNAP being healthy. I'm interested in people seeing that if they just invest a little bit in the fresh fruits and vegetables, and you put $500 more in this person's basket so they can buy what they need, you're going to be saving a lot of money on the back end from the healthcare costs. Let's just take diabetes to begin with, which is the kind of thing you get diagnosed with, because as we say, there's a problem getting diagnosed until you're really sick with a brain health issue. Okay, well, diabetes, we're on our way. And we can do something about it. And so we're trying to get the payers, the insurance companies. We're actually going after some of the employers who are insuring their own employees because they have a cost and capital issue when everybody's sick. So yes, we are trying to move the science forward. And with Sodexo right now, we are picking locations to do a pragmatic trial. We're coming up with our protocols. Love to talk to you all about it. And we are going to be tracking as we launch some of these in the new year, people on the diet and taking interventions. So yes, yes, and yes, we would like to have the involvement of this whole community in helping us do that. We also want to launch a global health challenge. With the technology you just saw, there's no reason we have to be in classic clinical trial situations when this can be in everybody's hand at the turn of the year. On your market, set, go. Do you want to share your information? We are creating a massive database. We're trying to help scientists with earlier detection and prevention around nutrition, food, and brain health. So we actually see a world in which very shortly people can choose, like my family would beg to put our data in so we can start getting some answers, anonymized or not.
And one last thought is, it's amazing to me how fast this stuff can happen. Like with small interventions, we can see someone go from pre-diabetic to completely normal, drop their A1C from 5.7 to 4.8, like within weeks or within days. Like small changes in diet can affect sleep quality. We see that with the Oura rings. And so it's pretty incredible, the real-time data, and we can see the effects of things. And also when you show someone, hey, you did this, you made this change, and here was the effect, I think people get really excited. They feel like a sense of empowerment that they can control their own health. And I think a lot of people are frustrated and feel like they can't.
That's great. I think there was another question at the back of the room. Yeah. Oh, there was two. Yeah.
While you were collecting all the data for brain health, did you also track mental health changes?
I'll go ahead and take that. We are literally just starting all of this. We're building the technology. We're in a position where we're going to be able to launch both through retail and large food service companies. So VitalityIP is an early stage for all of you guys who are out there interested in investing in exactly this. And we're building the data health platform. We've also got a lot of data from the retailers where we can start telling and be predictive earlier, people buying all the sleep aids and it's amazing the data that we can have if a consumer wants to know how to go on a different journey. So we're navigating all of this now. We have built a platform that the data can start collecting into, and this is early days. So come join us. This is about taking action. And again, all of us met through these convening organizations and meetings.
But I also think people thought anxiety and depression and other mental health things were not related to metabolism. 90% of Americans have metabolic dysfunction. And that was the case with me. 2 years of anxiety, it was crippling. And a week it was done through diet. And so I'm not saying that's the case for everyone, but I think diet and nutrition play a huge role in mental health.
So we've got time for probably the last three hands in the room, the lady at the back there, and
Again.
then yourself and yourself. Yeah.
I'm so excited about this because I personally live a personalized diet anyway. I have a question about, would you be open to connecting your already existing system to somebody else's system? Like the front face of somebody else's technology with your amazing structure?
Absolutely. This is the thing we're trying to do, and it's very antithetical to most for-profit startups. We've been called Switzerland, which we like. We shout it from the mountaintop. We're standing in the town square saying, this is what we're doing, and this is how we're doing it. Do you want to join us? Like everyone in this room, do you want to join us? Do you already have something to link off of? Or it's a major retailer, we'll come up through your app with a VIP solution that can personalize. We don't care. We are trying to change lives.
Perfect.
And so we're giving away the secret. This isn't, we're saying the quiet part out loud. Or if you don't want to work with us, please build something else that competes with it, because we're trying to create a marketplace where everybody cares about this. And that's happening too. And that's really cool, because I think this whole room is about creating markets and creating awareness. And so the answer is yes, and I love your session. Was my favorite so far.
Thank you.
And at my last Harvard meeting, I had people do exactly that, of like stop and breathe or stand up, which everyone should stand up because you can't sit for so long. But yeah.
Perfect. Thank you so much.
Right, the gentleman at the back here.
I wonder if you guys have thought about partnering with some of the large electronic health record systems. I'm thinking particularly of Epicosmos, which could give you really gold standard ground truth on your participants. It seems like a natural partnership for vitality.
Yes, yes, and yes. I mean, this is where the more data that we have, the deeper that we go. Some people may just want to scratch the surface and shop differently, live differently. Some people are already deeply. Anyone who makes it to senior living, as we know, my last company was 18 years building the technology infrastructure. We integrated with all of those data systems. And the more that we know about someone, if you're in senior living, you have multiple conditions and you most likely have dementia. And so, yes, I mean, the more data we have, the better. And then if insurance companies or others are attached and care that we're actually having outcomes, we can start changing the payer models, which we have to do because we all know that the people in poverty are way sicker because they have been eating the white bread and the mac and cheese and the processed things that they can afford. And we have a whole mess. So, yes.
It feels like you had access like to real A1C data in real time.
You bet.
Chunk of your cohort, you see what worked as well as what didn't work.
That's right. And actually, the most incredible data set I've ever seen is we were working with a retailer, and we have several billion rows of data. And so what you buy at the store tells us everything about you. I know that you have reflux. I know that you're getting migraines. You can't sleep at night. You're feeling stressed. You're buying, things to help with mood, the supplements you're buying. And so there's just tremendous data sets where you can learn so much about people even before they're sick. And also, that's over the course of a decade, right? So you're seeing shifts in families and patterns. And when people are open to that, like the coaching you can give, the insights you can get from that, it's absolutely incredible. And again, like back to the first data question, we have all this data. We're lacking the insights. And I think that's where AI can maybe help us get into the data and actually take it and do something with it versus it just being there, right? And I think the same thing for the EHR stuff.
Great. And the last question from the lady.
Just first of all, thank you for a great panel. Understanding that it's still early, going back to the mental health question that was raised, I guess it's more of a comment. I really love all the things about this. And I think about young people
Yes.
that are particularly transitioning between adolescence and young adulthood. I think about two different things from a mental health perspective. I'm thinking about early psychosis and when young people particularly may be experiencing as they go away to college, anxiety, depression, things that they didn't experience as teenagers. That is an opportunity where they are also learning new behaviors, such as how to cook. So even if, you grow up in a home and you know some family recipes, when you are on your own at that age, you're learning new recipes, you're learning new things. And so it's just such a ripe opportunity to teach new behavior and have potentially some impact on the way that individual's mental health wellness evolves.
Well, thank you. And hopefully whoever you're working for and with, we should be working together because we know this is birth to death. In fact, it's in utero. And the earlier we can get to people, my kids live differently right now. They live differently because they've experienced it. They and their friends. And the consumer research is showing us that the younger generation cares more about the organics and the crud that's in our food and all the rest than actually the rest of us do. There's a wave of people coming, and the school's number one crisis, just like in senior living, it's dementia, is the mental health crisis. Every university president will tell you that. We are deeply interested, and Sodexo is not to speak for them. We've known each other a long time, deeply interested in bringing this into the school systems and getting people earlier, having brain healthy options, having the information, all of these things. So yes, if we can start earlier, we're not in the catastrophic situation that we face.
Thank you.
And I'll complement to that by saying we have 5,000 or more dietitian and registered dietitian and nutritionists. They spend probably 75% of their time reviewing menus and building menus. What if, thanks to technology, they could spend 10% of their time reviewing menus only, and they could spend the rest of the time doing education? Exactly doing education, do the transition, or in senior living community for that matter, on why healthy food is also good for the brain, and so on and so forth. So I think we also, corporations like ours, have a responsibility of educating the consumer and not only providing what they want to eat because that's what the chicken nuggets are easy to sell and cheap, but also educating them and bringing them options that are good for them.
And that's where a case where, college student, taste, health, convenience, and value, right? They want it to taste good. They want it to be super convenient. How long do you have to prepare a meal? 5 minutes or less. Smoothies are a great option. How much you want to spend? Well, I don't have a lot of money to spend. With a smoothie, you can get a great, something great that's healthy for you, that takes 5 minutes, that's delicious, right? But that's just not something that they were exposed to, right? So that's where understanding who they are and what their circumstances are, then you can help coach them. But otherwise, maybe they're going to, get fast food or.